speaker is Dr. SHIRIN Fidha. And is Dr. Anju Chandran here? Dr. Anju Chandran? No. Dr. Mehak Raheja? Okay, so just be ready. You can kind of come here when she's finishing. Yes, doctor, please start.
Good afternoon, everyone. My study is on Igg4 related ophthalmic disease, an observational case series from a tertiary eye center in Kerala. As we know, Igg4 related disease is an idiopathic multi-organ inflammatory state. It manifests as chronic relapsing sclerosing inflammation in any organ system. The pathogenesis is thought to revolve around humoral and cell-mediated immunity. The ophthalmic manifestations of Igg4 related disease can be varied, most commonly affecting the lacrimal gland. The aim and objective of the study is to characterize the ophthalmic manifestations of Igg4 related disease and to study the disease response. It is a retrospective case series done at a tertiary eye center in Kerala. 5 patients were studied in a span of 2 years, and all patients who presented with Igg4 related ophthalmic disease were included in the study. A detailed clinical history was taken, uncorrected and biscorrectal visual acuity recorded, extraocular movements noted, slit lamp examination and fundus examination done, IOP readings taken by applanation tonometry. A detailed examination of the orbit was done, followed by magnetic resonance imaging, incisional excisional biopsy done, and sent for histopathology and immunohistochemistry. A panel of biochemical tests were also done. Moving on to the results and discussion, out of 5 patients studied, 4 were female, and the mean age at presentation was 40.2 plus or minus 15.43 years. And the presenting complaints were prominence of eye in 80%, double vision in 60%, and lid edema in 40%. This table shows the demographic details and clinical features of all the patients included in the series. As we can see from this table, lacrimal gland is the most commonly affected, followed by extraocular muscles and soft tissue. Only one of our patients had bilateral presentations and all others had unilateral presentations. Visual acuity impairment was present in one patient, and none of our patients had extraorbital manifestations. Serum Igg4 was checked in 4 patients and elevated in all the 4. There was rapid progression of disease in one patient, leading to profound visual acuity impairment. Radiological imaging showed the involvement of the lacrimal gland in 4 patients, extraocular muscles in 4 patients, soft tissue in 3 patients, and lacrimal sac in 1 patient. Figure A is a T2-weighted MRI axial view showing a nil-defined mass in the inframedial part of the right orbit with involvement of the extraocular muscles and the lacrimal sac. And figure B is a T1-weighted MRI post-contrast coronal view showing an ill-defined mass in the right inframedial part of the right orbit with involvement of the medial rectus and the inferior rectus. Histopathological analysis were available in all the cases, and a dense lymphoplasmacytic infiltrate was the main feature reported in all the cases. Fibrosis was noted in 3 out of 5 biopsies. Perivascular inflammation and eosinophilic infiltrate noted in 1 case. Immunohistochemistry for Igg4 positive plasma cells was done and was consistent with Igg4 related disease. CD3 and CD20 were also positive. According to the diagnostic criteria for immunoglobulin G4 related ophthalmic disease, 4 patients were classified into definite category and 1 patient into probable category. And after ruling out a systemic disease, treatment was started with oral prednisolone, mycophenolate mofetil, azathioprine or methotrexate. The mean follow-up period is 9.4 months, and only 1 out of 5 patients were reported to have recurrence. This table shows a comparison of various studies, and similar to our study, lacrimal gland is the most commonly affected. Serum Igg4 was elevated in most of the patients in all the case series reported. And unique to our study was that none of our patients had systemic manifestations. To conclude, what we knew before the study was the characteristics of orbital inflammatory diseases, and what we wanted to know was the characteristics of Igg4 related ophthalmic disease, its variable presentations, and treatment and response. And what we learned was that Igg4 related ophthalmic disease is a chronic painless subset of orbital inflammation. Histopathological examination is crucial in the correct diagnosis. Long-term follow-up is required. Prompt and accurate diagnosis ensures a good prognosis. These are my references. Thank you.
Thank you, doctor. So, what is your take home from this? Which are the cases where we should be suspecting that this is Igg4 related disease?
When there is a chronic inflammation, especially painless, which is a chronic fibrosing or sclerosing conditions, we have to keep this as a differential, and we have to do a proper workup before giving steroids or other immunosuppressive agents.
So, when do you think we should be doing a biopsy to confirm it?
When there is usually a fibrosing chronic swelling, which is usually painless.
Okay, thank you, doctor.